patient was a 3-year-old boy. He was diagnosed with congenital ventricular septal defect shortly after birth, and he underwent heart surgery at age of Y. The medial sternotomy was used in operation. After operation, the medial part of the anterior chest wall was gradually protruded, whereas bilateral parts of the chest wall are depressed. The deformity worsened with age. In order to correct the deformity, the child was admitted to our hospital at age of 3. Physical examination showed there was a surgical scar on the anterior chest wall. The medial part was protrusive, and both lateral parts were obviously depressed. No heartburn was heard by auscultation. Imaging examination shows that the anterior chest wall was protrusive in the middle, with acute angle deformity on top of the protrusion, and the lateral chest wall depressed on both sides. Echocardiography showed that the ventricular septum was integral without residual defect. The patient was diagnosed with secondary severe compound thoracic deformity before operation. After full preparation, the operation was performed under general anesthesia. 2 incisions were made on both sides of the chest wall respectively, with lengths of 2 cm. Willing procedure was performed. The operation was smooth without any complications. The deformity disappeared after operation. A follow-up for 1 year showed that the appearance of the chest wall was basically normal without obvious deformity. Cardiac surgery is usually completed through the medial sternotomy. If the sternum is not fixed firmly after operation, it may lead to secondary thoracic deformities. The most common deformity after operation is pectus carinatum, and relatively less common deformity is pectus ectovitum. But the compound thoracic deformity has not been reported. The deformity of this patient is special. His protrusion of anterior chest wall is extremely serious, with acute angle deformity, and there are symmetrical depression on both sides. Since this kind of deformity cannot be treated by the ordinary sandwich technique, we adopted a Willen procedure for this patient. In the operation, the protrusion was compressed with the middle of the steel bar. At the interior fixation point is located at the rib of the depression. The steel wires can lift the depression and fixate on the steel bar. Therefore, the depression can be eliminated. From the perspective of the treating simple, a Willen procedure is a template plastic surgery, so it can complete the correction of the various deformities at the same time, including protrusion and depressions. I'm Dr. Wang from China.